Good evening. My name is Rachel Gilbert, and I'm a senior here at U of R. I was a Deborah Elmar Civic Fellow this past summer, and I interned at the Faison School for Autism here in Richmond. So as a biochemistry and healthcare studies double major, I had a couple people ask me, why are you interning at a school? And what my answer to them is, and what I hope to kind of convey tonight, is the ability of the education world and the healthcare world to inform one another. So I basically had a two-part internship interning in the Center for Behavioral Sciences at Faison. So I worked in the after-school program, which is a lot more hands-on, where I was actually working with kids. And then I also spent the other half of my time working on some different projects and research survey work. And so my presentation tonight will kind of mirror those two experiences. So Faison, most of the students that attend the school, I would say 90% or more, have a diagnosis of autism spectrum disorder. And so ASD is characterized according to the DSM-5 by impaired social and reciprocal communication, as well as restricted or repetitive patterns of behavior. And so Faison is a 501c3 CABAS accredited school, which stands for Comprehensive Application of Behavioral Analysis in the School System. So all the services that are provided to those students and clients from ages of about 24 months all the way up to 22, 23 years old fall under the category of ABA therapy. So ABA is the golden standard for autism treatment. It's the most evidence-based practice. It's based on the principles of behavior analysis, which I know sounds a little bit confusing, but I'm going to give a couple examples to kind of explain it. So in the after-school program, I was trained to implement basic behavioral procedures and treatment in working with the students. So ABA is based on A, B, C, antecedent, behavior, consequence. So I'm working with a 6-year-old who's way better at math than I probably will ever be on his math facts program. And so the antecedent is me holding up a flashcard and saying that says 2 + 2 = 4. The behavior is him telling me 2 + 2 = 4. The consequence is me being like, yeah, that's awesome, that's right, you know, like super high positive reinforcement. But the goal is to kind of increase the frequency of that behavior and improve his overall learning, if that kind of makes sense. It's a very behavior-based intervention procedure. And what was really cool about ABA for me is that it goes beyond just academic learning. So I was working with a 12-year-old, and we were teaching her to wash her hands. And so hand washing was divided up into a bunch of different behaviors. So the first was walk to the sink. The second was turn on the faucet. The third was reach for the soap dispenser. So at the beginning of the summer, the antecedent, or what came before the behavior, was me giving her a full physical prompt and reaching for the faucet and helping her turn it on. About midway through the summer, the antecedent was me just giving her a gesture prompt and pointing to the faucet, and she's reaching for it. And at the end of the summer, she's doing this independently, and I'm like, that's awesome! Like, way too excited about it. But I can really see the progress in these kids. And I think this is a great example of how an educational setting can improve the hygiene of the child and the overall health of the child and those who are going to be around them. So besides working in the after-school program, I did a couple different projects. I'm just going to touch on 3 that were the most meaningful to me. Probably the most impactful. So the first being resource navigation. So Faison instituted a resource navigation program about a year ago, and I was charged with the task of creating a database of the different resources that are in Richmond and the greater Richmond area with the hopes of connecting families to these services for their children. And so this is a really great hands-on way for me to see what services are provided in abundance and which are not. So I was calling up, recreational activities, programs, and saying like, is this your right contact information? And things change all the time, and it was really cool to see like what actually is available to these families. So I also helped organize a parent seminar on interacting with your child's healthcare provider, which again goes back to the ability of an education world to facilitate a discussion between healthcare providers and parents. And so we brought in a pediatrician, a child life specialist, and an ER nurse to kind of help facilitate that discussion and hopefully improve the care that's going to be offered to these kids. And last but not least, I helped develop a quality of life survey. So at the beginning of summer, my supervisor and I were throwing around the question, how are these services actually impacting children outside and their families outside of Faison? And so I think looking at quality of life specifically is a great way and super essential to understand the difficulties faced by these families and also how you can better provide services. So after doing a pretty extensive amount of research on what surveys are already out there, there's not really one that was fitting, so we decided to write our own, which was a pretty daunting task. I didn't really know what I was getting myself into, but we created a survey, and it was divided up into 5 different sections. At the end of it, we got this, which seems pretty overwhelming, I know, but the survey was divided into 5 different sections: physical, emotional, behavioral, social, health, and then independence. And there was 5 questions in each subsection. It was rated on a 4-point Likert scale from strongly agree to strongly disagree. So you can see that here. And I could go into so many details about the different, implications of this survey, but I'm just going to focus on independence. And so basically, the higher the bar, the more strongly disagreeing parents are with these statements. So in the independent section, you can see the bars are much higher. Parents are really disagreeing with statements like, my child can function independently of my direct or constant supervision, or my child can complete wake up and bedtime routines independently. And what this shows us is that we need to, as in the services that we're providing, help teach these kids the life skills that they need to be independent, such as washing their hands. I had some, how do you use a fork? And that was something that we were working on with this child on. And these basic things that we just take for granted that are so easy and come to us, and these children actually need to be taught. And so besides helping the kids, we also really need to be supporting the families to help their child. So some goals with this research project moving forward: we're doing a lot of stats analysis, and actually in the process of writing a manuscript to submit to a journal. We have a couple target journals, which is really exciting, and goals of going to a conference. And I really think that this survey is filling a niche that's not otherwise being filled, especially in an educational setting. So we're looking at some gender analysis. What's really cool is that we actually had a lot of female respondents, which is very difficult to find in autism research. So I just want to close with talking about the positive cycle between education and healthcare. This is something that I read about my sophomore year in Dr. Mays' SSIR in a book called Getting Better. And basically what it says is that you can improve someone's education, you can improve their healthcare, and improving someone's healthcare can improve their education. I think that this holds particularly true for children with developmental disabilities. So if you can improve a child's healthcare, whether that's their physical and mental health, and you're allowing that child to function and grow and attend school and be in school longer by just improving their overall health, because a lot of these children suffer from a lot of other medical comorbidities, and they don't have the ability, a lot of them are nonverbal, they don't have the ability to say, my stomach hurts. We don't really know what they particularly need. So we really need to work on improving their health care and the services that we provide to them. So allowing them to be in school allows them to learn things like washing their hands. It allows them to, just improve their overall hygiene and improve their overall ability to communicate. And I think education also goes beyond just those students. I think it goes to the parents and the caregivers and endeavors like the parent seminar. And I think we can keep this cycle going and make an impact with this population. And at the beginning of the summer, I was like, oh, this is going to be so informative. I'm going to decide at the end of the summer I'm going to go to medical school or I'm going to be in the education world. And that it was going to be great. And I think what kind of happened is that I realized that I would rather be here or there and kind of in the middle between the two, and having a more holistic approach and a broader just perspective on the services that you're offering to children with developmental disabilities. So with that, I just want to say thank you to Cassie Grace and Dr. Mays. Eli Newcomb and Brittany Leggett were my supervisors at the Faison School. And of course, Dr. and Mrs. Burns for your funding through the CC. So thank you very much.